In all areas of surgery, there has been a strong move towards trying to do things through lesser incisions with less bleeding, less pain, faster recovery, so people can get on with their lives more quickly. The gold standard for heart surgery in terms of the surgical approach is an incision called a median sternotomy. That's an incision that divides the entire sternal bone from top to bottom, and depending on the size of a patient can vary from 8 to 12 inches in length. It typically requires a 3 to 4 month period of recovery to get back fully functional and without restrictions physically. The minimally invasive approaches involve incisions that are 1/3 to 1/4 of that size, maybe 2 or 3 inches, and allow for people to recover much more quickly from their surgery. If a 50-year-old man who likes to play golf had a sternotomy incision, we would recommend waiting 3 months before that person started hitting their driver and taking a full swing. After a mini sternotomy incision or a mini thoracotomy incision, people have gotten back to doing that 2 weeks after surgery. So it's a big difference in time of recovery. Stephen is a young and healthy, very, very fit man who had a mitral valve problem that he was beginning to suffer from.
It affected my life as far as being limited on what I could do physically. And at the end, I did not feel good this summer. It was getting bad.
He could have had any type of operation. He would have done fine with a conventional sternotomy. It would have taken him a little bit more time to recover. He would have had more time off work, which to him was critically important.
I went in and consulted with him. We chatted for quite a while. He explained what he thought he could do. He actually drew me out a great diagram of what his plan was. And then because of my job here, being off of work was a major problem. I asked him about the minimally invasive.
He ended up having a minimally invasive, a mini thoracotomy approach for a mitral valve procedure. Everything went well, and a week after surgery, when he came back to have some sutures removed, he was ready to get back to work.
After the surgery, the first 2 weeks, pretty much recovery, you're tired. By week 3, I was able to accomplish full day activities. Back to work in 3 weeks. Walking around, no problem. I was doing 2 miles on a treadmill within 2.5 weeks after surgery.
I think he's pretty content with how things went, and is a good example of how people can really get back to normal functioning and normal life much more quickly after a minimally invasive procedure. In general, minimally invasive approaches are widespread across the nation, but they're in pockets in specialized centers. And in northeastern Wisconsin, among the hospitals in the Green Bay area and the Fox Valley, we're the only center who's offering this variety of minimally invasive approaches for valve surgery.
If they're eligible to do a minimally invasive procedure and they think it'll work for them, do it. This is great. This is new technology. Dr. Gerndt has obviously mastered the technique. We had 0 issues with me. I would recommend this to anybody at this point.